From the time the COVID-19 pandemic was announced, the healthcare facility in the Sultanate were well geared to deal with the virus. Ibra Hospital is one of those institutions that had made a comprehensive plan put in place for all scenarios to manage the situation. Since then, the entire Ibra Hospital staff have been working in providing quality healthcare to all, taking into consideration all precautionary measures. Dr. Saleh Sawafi, head of the orthopedic department of Ibra Hospital, produced a film. Abdallah bin Ahmed Rubaiey took us through the story of this journey in providing such dedicated care. Through this film that he produced, the story read by Abdallah bin Ahmed Rubaiey.
Dr. Saleh Sawafi, head of orthopedic department, narrates the story of providing such dedicated care through this film that he has produced, titled 2020 Flying with Pandemics. The story summarized by Abdallah Rubaiey. Suddenly, the world woke up and, witnessing big malfunction in its priorities, it tracks and interest. The pandemic that came to interrupt and break the normality, where people are kept away from masjids, markets, shops, colleges, schools, and social gatherings. Confusion, fear, and anxiety circulated around the globe. It has affected the scholars, the wise, the politicians, and the rich. It hit more deeply to patients and poor people, where it clearly indicates to whom is the kingdom belongs. Here in Oman, our leader, His Majesty Sultan Haytham, an excellent successor to an excellent predecessor, His Majesty ordered a formation of a Supreme Committee to tackle COVID-19. In the middle of the battle, courageously came to dwell that doctor and the nurse, medical orderly, pharmacist, lab specialist, sanitary personnel, everyone in the hospital, all to be soldiers who have been working non-stop since then. Sticking to science and evidence, they rush to tackle the pandemic. Their determination is reassuring. God's kindness is around with all of us. On every endeavor, between the hospitals and their homes, their mind and their hearts attract obsessions, thoughts, and anxiety. Will this day pass safely? Or will he return to his village and his family and have passed on a painful infection to them? Or will he or she catch the infection from patients who are attending the clinic? Or he and his colleagues in the field may be infected by friendly fire. Perhaps he or she will contribute in the way that he does not know the loss of someone precious to him, or a colleague in the field, or himself will have to leave early with the victims, and he will not have the chance to see the end of the pandemic and the shape of the new world. Wearing light scrub on his way, although his head is heavy with loads of these concerns and pain of these obstacles, all of these will be completely reversed at the first step in the hospital. And these concerns turn into protective clothes, somehow hinders the airflow to his lungs, which slows his movements, but opens reassurance and peace to the world. It mixes with his heart to fill the place with happiness and with great kindness in providing patient care, where he chases the epidemic in all corners of the hospital, sincerely with dedication. They examine samples with accurate devices from the sample they took and come out with a result and finalize diagnosis. And with the science they fight it, and with God's grace they treat, and others in the field continue dealing with the pandemic. Their weapons are these simple tools, great in its work, brilliant with its results. It's the weapon of mankind. It's the gold, and who lost it, it has gone away. Colleagues meet with masked faces, with physical distancing. They discuss the health of their patients. Their minds are combined and their will is united to resolve the problem. In a row, as if they are a single solid structure, they send a message of reassurance and calm. Whomever revives it is if he has revived all mankind. No matter how narrow the path is, they do open the door of hope and they continue on the holy path to provide treatment and care as well as perform urgent surgeries efficiently. Despite the risk of infection for all, as all knows, countries have been shaken and fallen to a pandemic, where the operating theatres were converted to an intensive care unit and all surgical operations were put on hold, as they are very hopeful and optimistic about healthcare professionals. Yes, you and all adhere to the decisions and instructions of the Supreme Committee dealing with the pandemic. At the end of the day, they return to their homes. They send high praises, thanking the Almighty who prepared them to face the pandemic among all mankind. Their return will not be to meet their parents and children, but they will work towards removing all that can cause difficulties to their family in order to prevent them from this pandemic by diving into the river of hope and optimism until the medicine is discovered. This is cold shower and a drink to shine the sun of wellness. They return safely and securely to their family. Tomorrow awaits them a new flying with pandemic.